Welcome everyone to the Parkinson's Foundation's PD Health at Home Wellness Wednesdays webinar. Thank you for joining us. We will begin soon. Please know that we are recording today's presentation. You will receive a follow-up email from us with a link to the recording and additional resources in about 1 week. Hopefully this offers some comfort so you don't need to scribble down notes and just really be present with what we're sharing during our webinar today. And again, always thankful for you being here and for showing up with a sense of curiosity to learn more about yourself or a loved one living with or impacted by Parkinson's. PD Health at Home is presented by the Light of Day Foundation, whose generosity has made this programming possible. Thank you, Light of Day. Today's PD Health at Home Wellness Wednesday webinar offers an introduction and a basic overview of Parkinson's disease. PD varies from person to person and it changes over time. So we'll explore what causes Parkinson's disease, the common symptoms of PD, what treatments are available, and effective strategies for managing the symptoms of Parkinson's. We'll also learn some practical daily living tips to empower you to take charge of your health and to navigate the challenges of living with Parkinson's disease. Leading the presentation today is the Parkinson's Foundation's Chief Medical Officer, Sneha Mantri. Dr. Mantri is the newly appointed Chief Medical Officer at the Parkinson's Foundation. She brings a deep commitment to improving care, advancing research, and centering the voices of people living with Parkinson's in her work. She is an Associate Professor of Neurology at Duke University and a nationally recognized leader in interprofessional care, in health equity, and in narrative medicine. Dr. Mantri leads the Thrive PD program, an innovative early intervention care model for people with Parkinson's across the Carolinas, and was recently named a Macy Faculty Scholar for her work in community engaged and humanistic care. Throughout her career, Dr. Mantri has remained grounded in the stories of her patients and passionate about helping people achieve what matters most. It's a true pleasure to welcome Dr. Mantri to her first debut and joining us in our PD Health at Home Wellness Wednesdays webinar. Thanks for being here, Dr. Mantri.
Hi, everybody. Thank you, Krista, for that delightful introduction. I'm so pleased to be giving this talk today on Parkinson's basics, what you need to know as a person with Parkinson's or a person who is supporting somebody living with Parkinson's disease. As Krista mentioned, I'm a movement disorders neurologist based in North Carolina. I saw some fellow North Carolinians in the chat there, so always delighted to see people virtually and hopefully give you an opportunity to think about, as someone with Parkinson's disease or the care partner of someone with Parkinson's, what you can do to help ensure that your disease course is as smooth and as effective as possible when you meet with your neurologists. So with that, we'll go ahead and get started with the presentation. So there's going to be a lot of things sort of on the docket for today. We're going to talk about what Parkinson's disease is and what causes it. There's a variety of different things that can go into a diagnosis of Parkinson's disease. So we'll talk a little bit about what those symptoms may look like, what the diagnostic process might look like. And then we'll touch on some disease management and treatment strategies, really with an emphasis, as Krista mentioned, on ensuring that you have the resources that you need to be able to advocate for yourself well, and to communicate with your care team, wherever they may be, about what matters to you, and to help your neurologist and your other care team members help you as best as possible. So Parkinson's disease is a chronic illness. It's a progressive illness, like many other neurological conditions. Unfortunately, right now, there is no cure for Parkinson's disease, but a lot of the symptoms can be treated and managed and help people live as well as possible for as long as possible. It's also important to remember that Parkinson's disease affects a lot of different aspects of a person's life. It can certainly affect movement and physical symptoms, but it can also affect your mood, it can affect your thinking, and a whole host of other potential symptoms. As I mentioned, we'll go into some of those in a little bit more detail in a moment. And because Parkinson's disease affects so many different aspects of quality of life, there's a lot that you can do in terms of healthy lifestyle choices to help maintain your quality of life, help improve your quality of life, regardless of what stage of the disease you're at right now, and where you may be in the future. About 1 million people in the United States right now have Parkinson's disease. It's one of the most common neurological conditions, and it's actually the fastest growing neurological condition. Some work done by us here at the Parkinson's Foundation a few years ago found that every year 90,000 people are diagnosed with Parkinson's disease. That's about one person every 5 to 6 minutes. So this is a huge, huge concern for us in the clinical sphere in terms of, recognizing Parkinson's disease symptoms, acknowledging them and treating them effectively. It's also important to remember that Parkinson's disease can affect anybody, regardless of your ethnic background, your gender, your race, or even your age. The average age of diagnosis is about 60 years old, but a spare number of people with Parkinson's, somewhere in the 2 to 10% range, depending on which study you look at, are actually diagnosed much younger. People who are diagnosed before the age of 50, for instance, are kind of categorized a little bit differently as young onset Parkinson's disease, or YOPD. You may see that acronym around in support groups or on the Parkinson's Foundation website. So it's important to remember that Parkinson's can affect anybody of any age and race and ethnicity and gender. There's a lot of different things that cause Parkinson's disease. I think the current thinking is that there's no one single factor that causes Parkinson's disease for everybody. Instead, it's a combination of different factors. Like you can see in the graph there, sort of a puzzle piece of your genetic internal risk environment that there's about 10 to 15% of people with Parkinson's disease are known to carry a genetic risk variant that increases their risk of Parkinson's disease. But there's also really substantial contributions from environmental exposures, both exposures you may have had in childhood, in the workplace, at home, in midlife, as well as ongoing exposures as people age. And then a variety of other, what we call other lifestyle risk factors or risk factors in general. Things like traumatic brain injury will increase the risk of Parkinson's disease. Certain types of activities can decrease the risk of Parkinson's disease, and so on. So it's always this interplay between genetics, environment, and other modifiable risk factors that a person is living with that sort of accumulate over time, we think, and lead to the symptoms of Parkinson's disease. Fundamentally, what's happening in the brain when we say somebody, quote, has Parkinson's disease is the loss of a particular type of brain cell that produces a chemical, a neurotransmitter called dopamine. And dopamine does a lot of different things in our brain. You can see a list of some of those here on the slide. But one of the main things that it helps with is coordinating movement and essentially getting the signals from here, what you want to do, out into the muscles in a smooth and appropriate way. So people with Parkinson's can have a lot of trouble with coordinating their movements, with fatigability of movement, meaning the more you do something, the harder it feels like it is to do. That can also affect your speech, your sleep, your thinking and cognition, your mood, and so on. There's a lot of different factors, as I said, that dopamine impacts in the body and in the brain. And the picture here on the right shows you what a normal neuron would look like, where it's producing a lot of these little green dopamine vesicles, and then that leads to normal movement in the downstream pathway. But in somebody who has Parkinson's, they are probably producing a lot less dopamine. And so their movements are slowed or more effortful, and so on. And so this is a really big area of Parkinson's research right now, is how do we slow down the loss of dopamine? How do we stop the loss of dopamine? Is there a way to make the dopamine cells that stopped producing, can we make them start producing again? So this is a really active area of research right now in terms of looking for a more effective treatment or a cure for Parkinson's disease. I think it's important when thinking about Parkinson's disease to remember that it affects so many different parts of a person's body. I often use this iceberg analogy where the physical symptoms might be above the surface, the thing that you see, but a lot of the symptoms of Parkinson's are actually below the surface and may not be visible to other people, but can really affect a person's quality of life. So we're going to go through what some of those different systems and symptoms are right now. But it's one of the reasons why we sometimes call Parkinson's disease a movement disorder is because historically, all we knew was the stuff above the surface of the water, the visible part of the iceberg. And it's only in the last perhaps 10, 15, maybe 20 years that people have really started to pay more attention to all of the stuff below the surface. And I think that that's a really important thing to bring up, for instance, to your care team, as symptoms may be affecting you, but not visible to other people. We as doctors and nurses and therapists really rely on your report and on the report of care partners to understand how those symptoms may be affecting you. So some of the movement symptoms or motor symptoms that we look for when we're thinking that somebody might have Parkinson's disease are a shaking, tremor, often in the hand or the foot, but it can also affect other parts of the body, particularly as the disease progresses. Tremor is probably the most visible or the most recognized symptom of Parkinson's, but it's really important to remember that not all people with Parkinson's disease have a tremor. About 1 in 8, 1 in 9 people with Parkinson's disease may never have a tremor at all. So just because a person doesn't have tremor doesn't mean that they don't have Parkinson's disease. I'm sorry for the layered double negative there, but hopefully you understand where I'm going. The other things that we look for, the really key feature of Parkinson's disease is the second bullet point here, which is slowness or trouble with movement. In medical terms, that's called bradykinesia. You may see that term online or in your doctor's notes. But bradykinesia is essentially the smallness or slowness of movement that can develop because of that loss of dopamine. So for instance, in your doctor's office, they might ask you to tap your fingers together really big and fast. And sometimes it's easy to do that early on, but the more you do it, as you're doing it for 30 seconds, a minute, 2 minutes at a time, the movement becomes a lot harder to do because your brain isn't making the dopamine that it needs to keep that movement going. Some of the other things that we look for clinically are stiffness or rigidity. Again, often tested in the arms and legs, but symptomatically will also affect the neck, the hips, the trunk, all different parts of your body can feel kind of stiff or rigid. And then that can lead to problems with walking, problems with balance. If you fall, you may not be able to catch yourself as quickly, things like that, all because of the bradykinesia and the rigidity that are kind of the hallmarks of Parkinson's motor symptoms. But as I alluded to, there's a lot of non-motor symptoms or non-movement symptoms that often, frankly, drive quality of life for people with or without Parkinson's disease. So things like your mood and your mental health. I think we're historically not been so good at recognizing this, but are making a more concerted effort to talk about depression and anxiety in Parkinson's. And then this third bullet here is a very, I won't say completely unique to Parkinson's, but very common in Parkinson's condition, called apathy, which is a sort of loss of interest in things you used to like to do. Sometimes my patients describe this as just feeling kind of blah, like you don't have the urge to go and do things that you used to really like. Parkinson's can also affect your thinking and memory, particularly with paying attention to new things or learning new things. Slowness of thinking, or people sometimes describe brain fog, trouble remembering things, whether that's words or names, or even finding your way around in a familiar situation. And then people can also have a lot of other symptoms that kind of straddle the line between movement and non-movement symptoms. So things like softness of speech, trouble with your sleep, especially falling asleep too easily, or trouble waking up in the middle of the night and then have trouble falling back asleep. A lot of fatigue can be really challenging for people with Parkinson's disease, especially again as that dopamine level decreases throughout the day, as you're moving around and quote using it up. You can get more fatigued. And then constipation is a very common early symptom of Parkinson's as well. Hallucinations and delusions are something that I think a lot of people worry about with Parkinson's. And hallucinations, or seeing things that other people don't see or hear, do certainly happen for a lot of people. But I think it's important to remember that, number one, they're often a later symptom of Parkinson's. They're not usually something that happens early on. If they do, that should be a prompt for you and your doctor to look for other, potential causes of hallucinations. But also to remember that not all hallucinations are scary. Sometimes people can have hallucinations of, really pleasant things, reminders of people that they used to know, for instance, or flowers or things like that. So one of the things I often ask my patients when they mention hallucinations to me is, the first question is it scary or is it bothering you? Because if it is, there are certainly things, for anything on this list, things that uh, can help treat these symptoms. But it's also important to remember that any medicine has a side effect. And so you're always trying to balance how much does the symptom bother you versus the risks of medications associated with them. So we're going to take a minute now and talk about some of the potential early signs or warning signs of Parkinson's disease. None of these things by themselves will make or break a diagnosis like Parkinson's. It's important to remember that, nothing is a slam dunk here, but this is the sort of thing where if you're experiencing a couple of these, 3, 4, 5 of these symptoms, it's worth it to bring it up to your doctor and talk about, what treatments can be done for these different symptoms and signs. So the first thing that we'll talk about is tremor. As I alluded to, this is often the thing that gets people's attention when they have Parkinson's disease, and it's a really common sign in Parkinson's disease. The majority of people have tremor, but not everybody with Parkinson's has a tremor, and not everybody with a tremor has Parkinson's. Tremor or shaking can be normal after really strenuous exercise, during stress, after an injury. There are other medical conditions that can cause tremor, both, as a side effect of certain medications, but also by the condition itself. For instance, essential tremor is a non-Parkinsonian form of tremor, and it's important to be able to distinguish those with a trained neurologist exam. One of the other really common early signs of Parkinson's is small handwriting, or a change in your handwriting. It's sometimes called micrographia for small writing. But handwriting can also change just naturally as people age. So again, it's not, in isolation, small handwriting wouldn't be associated with Parkinson's, but it certainly can be a sign of Parkinson's disease in the right setting. Many people with Parkinson's disease have a loss of sense of smell. So particularly for strong smelling foods, like this guy in the picture, I think is smelling an orange, or coffee beans or other, really intense flavors. If somebody's no longer able to smell that as well, that could certainly be related to Parkinson's. But as I think we all know, there's lots of other things that can affect your sense of smell, including respiratory viruses, head injuries, especially anything that led to an injury to your nose or your cribriform plate. All of that can affect your sense of smell. Trouble sleeping is a really common sign in Parkinson's disease. I would say that the most common thing I ask people about is whether or not they act out their dreams, for instance, kicking or fighting or punching in their sleep. That's now thought to be really a not even so much a warning sign of Parkinson's, but really the very, very earliest change in dopamine in the brain is what leads to that acting out of dreams. Now, if it happens just once or once in a while, I don't know that I would think much of it, but certainly if it's happening regularly or if it's getting worse, it's definitely worth bringing up with your doctor for further evaluation. We already alluded to some of the stiffness or the walking changes that can happen with Parkinson's. But of course, any kind of musculoskeletal issue, whether it's arthritis or another type of injury, can definitely affect your walking and your gait. This is an area where I rely a lot on my physical therapy colleagues to help me understand, what could be causing or what contributors there are to a person's gait changes. How much of it is related to Parkinson's, how much of it may be related to a hip injury or arthritis or other things that can happen to people as they get older. Constipation, as I mentioned, is a really common early sign of Parkinson's as well. But there's a lot of other things that can cause constipation, especially diet. If you don't drink enough water, if you don't eat enough fiber in your diet, and certain medications can also increase the risk of constipation. A soft voice or a low voice can be really distressing to people. It can make it hard to communicate with others at times. So it's important to evaluate with either a speech and swallow therapist or an ear, nose, throat specialist to try to figure out where that's coming from. Is it an issue, for instance, with the vocal folds themselves, or is it something more related to, to Parkinson's? You sometimes hear people talk about a masked face with Parkinson's disease, or sometimes called a poker face. That's almost like a flattening of your facial expression. And even when you're feeling happy, you're feeling really sad, your face just kind of has this blank or poker face look. That can certainly happen with Parkinson's disease, but there's other things, particularly certain medications, that can lead to a very similar kind of facial appearance. So it's not something that, again, is like a slam dunk for Parkinson's disease. Lightheadedness or fainting, again, is something that certainly needs to be checked out and evaluated by a clinician. It can be linked to Parkinson's disease, but by the same token, particularly certain medications can affect your blood pressure and make your blood pressure drop when you stand up. Dehydration, especially if you're going to be outside in the heat in the summers, it's important to stay hydrated and reduce your risk of getting lightheaded or fainting. And then changes in your posture, especially leaning forward or hunching, can happen in Parkinson's disease. It's in part a response to the balance issues that people have, because if you lean forward a bit, you can kind of get your center of gravity back, but sometimes I worry that people might lean forward a little too much and then their center of gravity gets even more off balance. So if you notice yourself kind of stooping more than you used to or punching forward, it's important to evaluate why that's happening. Is that Parkinson's, or is that an orthopedic issue or an injury or something else? So once you've kind of gone through this whole gamut of symptoms and signs of Parkinson's, it's really important to make sure that you have the quote, right diagnosis or early diagnosis, because we know that early diagnosis can really improve quality of life. for people with Parkinson's. Um, it's diagnosed essentially by a clinical assessment, usually by a neurologist or a movement disorder specialist. Some people get their Parkinson's care from a primary care provider, but as long as the person that you're seeing is confident and comfortable with the Parkinson's clinical assessment, that's sort of the way officially that we make a diagnosis. There are some tests and tools that can be used to support a diagnosis or rule out other things. For instance, a DAT scan is a test that looks at dopamine transmission in the brain. It's usually not necessary in a for people with Parkinson's, but sometimes, especially if there's a question of, for instance, medication issues or tremor related to essential tremor, a DAT scan can be used to help differentiate those. And then similarly, in the last year or so, there's been a lot of attention to this new skin biopsy test, which again can help support the diagnosis if there's uncertainty, but the skin biopsy test does not in itself make or break the diagnosis in the absence of clinical signs and symptoms of PD. And once somebody has a diagnosis, there's always a lot of talk and discussion around treatment and when to start treatments and what the right treatment is. And that's a very, very individualized decision between you and your neurologist or whoever is helping to manage your Parkinson's symptoms. The ultimate goal of any type of treatment is to manage the symptoms and to help people with Parkinson's live as well as possible for as long as possible. And because there's such a variety of different symptoms, and symptom A may affect one person more than symptom B, but for another person, those might be reversed. The decision on which medicines to start and what symptoms to target is really, really individualized. But I'm going to kind of go through some general principles here that hopefully will help you as you're thinking about your healthcare team in Parkinson's. It's really important, I think, for a disease as complex as Parkinson's to have a lot of different people kind of weighing in and giving you input on what works best for you. As always, the person with Parkinson's disease is sort of the driver here of this healthcare bus, if I can use a different analogy, or the quarterback of the team. That's probably a better way to put it. But you want to make sure that you have somebody who's well trained in movement disorders care, a nurse, like a nurse hotline or a nurse that you can reach out to with questions, physical therapy, occupational therapy, speech therapy, social work, mental health specialists, pharmacists. All of these people are really, really critical to making sure that you're getting all the information that you need to make the right decisions for you and for your family. So there's lots of different ways that you can find a good specialist for Parkinson's disease. It's always helpful to, talk to other people that you may know locally who have Parkinson's. Who would they recommend you they see? There are online resources as well through the Movement Disorders Society website, has a Find a Doctor search function. And you can always call the Parkinson's Foundation helpline at 1-800-4PD-INFO and ask for help finding a movement specialist near you or a general neurologist near you to help answer all your questions and make you feel comfortable with whatever the treatment plan is. I always say that the mainstay of treatment in Parkinson's disease is exercise, 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 and therapies, physical, occupational, and speech therapy, as well as mental health support through counseling and either one-on-one or couples therapy. And there's also a lot of different medication and surgical options. Like I said, we'll touch on these briefly here, but these are important to talk about with your own treating team as to what's the best option for you. The reason why I really drive home how important exercise is, because exercise not only treats the symptoms in the moment, things like balance and mobility and flexibility, But it can also treat a lot of secondary symptoms like mood issues, particularly depression, we know responds well to exercise, that kind of dopamine surge of exercise. Constipation gets better when you exercise. And exercise has some evidence that it may actually slow down the progression of the disease. So not just symptom management in the moment, but also long-term benefit for living well with Parkinson's. And my philosophy here, because there's so many different types of exercises, and some people like one type versus another type, is to really find something that you enjoy, because then you'll like doing it, you'll stick to it, and you'll keep up with it. A good rule of thumb is about 150 minutes a week of something physical, physical exercise. So whether that's running or swimming or stationary bike or Tai Chi or weights, but something that is getting your heart rate up, getting you moving a little bit, that's where you really see the benefits. So you want about 150 minutes a week of that, or about 20 to 30 minutes a day. Nutrition is also a big part of symptom management for Parkinson's disease. Hydration is a huge issue. I've already alluded to the difficulties with dehydration and dizziness and lightheadedness. So staying well hydrated is really, really important, especially if you're going to be exercising. Make sure you stay hydrated and you replace your electrolytes. But it's also important to increase fiber. That helps with constipation, that helps with gut health in general. Um, and it's a good idea to think about what I call a colorful plate. So think about, including leafy green vegetables and bright fruits. And if you're going to choose fish or meat, make sure that it's been farmed well, and that it's been as free as can be from different kinds of pesticides or other exposures. A Mediterranean diet is often recommended and can be a really good place to start nutritionally. And it can also be helpful sometimes to meet with a registered dietitian, if your insurance company has one on staff, or if your local hospital system has a registered dietitian, to talk about your specific diet and how you might want to change that or modify that for Parkinson's care. The other big area of symptom management for Parkinson's is around mood and relationships. And there's lots of different ways that people manage this. Support groups can be a real great source of support, as the name implies, both in person and online, an opportunity to really make connections with other people with Parkinson's, and to become empowered through those conversations. Many people also benefit from individualized counseling or psychotherapy one-on-one with a psychologist or a social worker, because getting a diagnosis like Parkinson's disease is a big diagnosis for many people. There can be an adjustment period, and it can be really helpful to have somebody help you through that adjustment. And then, thinking about family relationships and the impact of Parkinson's disease on family members and care partners. There's also family therapy, either couples counseling or larger family therapy options to help family members and care partners support their loved ones as best as possible with Parkinson's. And then in the last few minutes here, I'm going to touch on symptom management for medications. Again, these are always conversations you want to have one-on-one with your doctor, because there's so many different options now for medications for Parkinson's disease. I've listed just a few different, what we call disease classes or types of medicines here. Fundamentally, all of the medicines for Parkinson's, or I should say the vast majority of medicines for Parkinson's, are really trying to affect that dopamine system in the brain, help your brain produce more dopamine, keep the dopamine around for longer, trick your brain into thinking that there's more dopamine around than there really is. And we can do that in a variety of ways with a different, often a cocktail of different types of medicines. For people whose symptoms can't be controlled with medication alone, there are some really good surgical options. The one that's been around the longest, if you will, is deep brain stimulators, or DBS, which are a way to help control Parkinson's symptoms using electricity rather than medicines. I think of it as a little bit like a pacemaker, but instead of a pacemaker for your heart, it's a pacemaker for the part of the brain that's causing Parkinson's. More recently, there have been different types of pumps that have been developed as well. There's a pump that delivers a levodopa gel. There's now a phospholevodopa infusion that's a little bit like an insulin pump in design. And so these can be really helpful for people who are having a lot of issues with their gut motility or constipation. It makes it hard for them to absorb medicines by mouth. But if we can deliver the medicine in a different way via a pump, that can sometimes really help some of those symptoms. So making a decision around surgery is obviously a big deal, and there's a lot of different factors that go into this, but it's important to make sure that if you do go down this route, that you have both a physician and a surgeon who are helping you through it, who are well trained and really confident in their process. And then, as I've alluded to already, research is so important in Parkinson's disease. And for those of you on this call who are participating in research, thank you so much. You are directly helping us come up with new therapies, new treatments, and hopefully a cure for Parkinson's in the very near future. There's lots of different ways to get involved with research, depending on where you live and what you're interested in. The Parkinson's Foundation website, either call the helpline or go to the website's research section to find something that resonates with you. You can also go to clinicaltrials.gov. That's a US government website that collates not only studies that are happening in the US, but many studies that are happening overseas. And the nice thing about clinicaltrials.gov is you can also search by location. So you can find something that's close to you and that, again, resonates with you and helps everybody understand the impact of Parkinson's disease on people's lives and the impact on bringing us closer to a cure. So just to summarize some key takeaways, I know I've been talking a lot and we'll get to, I know there's a bunch of questions in the chat that we'll get to in just a moment. But, I think it's really important to remember that Parkinson's can affect a lot of different parts of your body. But a lot of those symptoms can be managed very effectively. It's important in order to do that, to make sure that you get a diagnosis as early as possible, that you assemble a great treatment team that understands you and your goals, and that, symptoms can really vary from one person to another, and can include both movement and non-movement symptoms. One of the things I often tell my students and neurology residents when they're rotating with me is, if you've seen one person with Parkinson's, you've seen one person with Parkinson's. And everybody's Parkinson's is so unique and so different and affects them in different ways. So it's really important to make sure that you're thinking about the balance, again, of motor symptoms, non-motor symptoms, what's bothering you the most, and how can your care team help you achieve your goals in the next 6 months, year, 5 years, and longer. So with that, I'll just say thank you for this opportunity to present some tips and tricks in managing Parkinson's basics with you all. I'm going to stop share, and then I think, Krista, we can probably go to the Q&A.
Great. Thank you, Dr. Mantri. Really appreciate the way that you invited us into the basics of Parkinson's disease. And I can tell here by the Q&A that our community knows a lot about Parkinson's, and they're asking some really good questions that go beyond just the basics of Parkinson's. So thank you for gifting us that knowledge so that we can come from a place of knowing, so we can share with family members, peers, colleagues, and learn more for ourselves. So thank you, Dr. Mantri, for that overview. I'd love to start with movement symptoms. So there are a couple of questions from Keith and Dale talking about dystonia. So Keith shares that it seems like many people in their support group report discomfort from dystonia in their feet, legs, hands, and shoulders. I'd love first, Mantri, if you could define what dystonia is for our community here, learning the basics of Parkinson's disease. And then answer the question of why is this not considered a common symptom of Parkinson's disease?
Yeah, that's a great question. So dystonia is essentially muscle cramping or twisting or turning. It can affect, as the person alluded to, it can often affect your feet or your hands or your arms. Sometimes they'll kind of twist in or turn in, and it can be really painful because you can imagine if that muscle is kind of becomes fixed in that position, it can be really tight and really, really difficult to use. Um, I would say that for many people, dystonia is, for many doctors, I should say, dystonia is often unrecognized unless your doctor is a movement disorders specialist or a movement disorders APP, advanced practice provider. They may not know to ask about dystonia. So if you're experiencing that, it's important to bring it up, I think, proactively to people and describe it, as that cramping or twisting or turning. Because there's lots of different ways to help treat and manage dystonia symptoms. One of the simplest things to do for many people is just adjusting the amount or the timing of the medication that they're taking to kind of smooth out the dose so that it's not going up and down and wearing off in between times. For some people, especially if the dystonia is very, very focal, for instance, if you have foot cramping where your toes kind of cramp and curl in, there are procedures that can be done to help relieve that. For instance, botulinum toxin injection, same stuff they use for wrinkles, will help relieve that, the tightness or the muscle spasm in the foot and can be really, really helpful for focal dystonias like that.
Thanks for describing it and also naming that this is an experience with many people with Parkinson's. And Keith and Dale, just want to acknowledge and celebrate you bringing that to the conversation today. So thank you, Dr. Mantri, for addressing it. Angela wants to learn more about dyskinesia and understand, like, is this a side effect of levodopa? Could you just elaborate a little bit more about what is dyskinesia and is it caused by medication?
Yeah, wonderful question. So dyskinesia and dystonia are sometimes thought of as like two sides of the same coin. Unlike dystonia, which is a cramping or tightness, dyskinesia is almost like excessive looseness in your muscles. So sometimes what it can look like is like a restlessness. So people are kind of wiggling or twisting, or they can't seem to sit still. It's a very common issue with long-term or it's kind of mid to late stage Parkinson's, I should say. So um, dyskinesia is in some ways considered a side effect of levodopa, but it's a side effect that happens only at a particular point in the disease. Um, Early on in Parkinson's, and by early, I mean in the first several years, the exact amount kind of varies from person to person, but early on, um, you have lots of those dopamine cells still in your brain. They may not be producing 100% of the dopamine you need, but they're there and they're making maybe 50% of the dopamine you need. So when you take levodopa by mouth, it gets taken up by those dopamine cells and they release it in their nice, steady, sort of buffered fashion. But over time, as you lose those dopamine cells, the cells themselves, the levodopa gets taken up by sister cells, things like norepinephrine cells or other adrenergic cells. And they know how to release levodopa, but they don't do the buffering very well. And so what can happen is they release all the levodopa at once, and people get very dyskinetic. And then their medicine, sometimes people describe it as a crash or a sudden wearing off, and then they become dystonic. So it can feel like you're kind of yo-yoing between these two things, really because you've reached a point in the disease where there aren't enough dopamine cells to help manage the amount of levodopa you're taking. So that's an area where definitely, talking about adjustments in dosing strategies for some of these, potentially a surgical option to help reduce the amount of medicine you're taking each time can be really helpful for people in that dyskinesia dystonia stage.
And staying in the lens of the basics of Parkinson's, for the sake and intention of this webinar today, could you explain, Dr. Mantri, what the vernacular or the language of on and off means for the
Yeah.
Parkinson's community?
Yeah, for sure. So the on and off terms really come from trying to describe people's response to levodopa in a very quick shorthand. So as I alluded to early in the disease, people often don't have on times and off times because they take their medicines, the medicines work, they're buffered through the day, and their things are generally decent. But for many people at some point, they'll start to get this on time where the medicine is working well, and, relieving the symptoms. But then the medicine stops working. We sometimes call that off times, like the medicine has worn off, is where the term really comes from. So you'll sometimes hear people say that, as trying to get to a shorthand for explaining this whole process of the ups and downs and the turning on and wearing off phenomenon that can happen at some stage in the disease.
Thanks for helping us understand the language as we kind of begin to, or maybe it's been a few years of navigating our Parkinson's journey. In the vein of movement symptoms and perhaps non-movement symptoms, but related, this phenomenon that stress can cause on Parkinson's symptoms. And Scott, thank you for sharing a bit about your history and sending you blessings and just deep gratitude for what you and your wife went through. And also, Michelle is really curious about how stress impacts Parkinson's symptoms. Why does stress seem to exacerbate the movement symptoms? Could you speak to that?
Yeah, that's a really good question, because it's something that I think impacts a lot of people in a lot of different ways. Particularly, what I often hear from people is that stress, both physical stress and emotional stress, can make tremor more noticeable. It sort of revs you up, is how I think about it, and it can make people feel more jittery or more tremulous. Stress can also impact your gut motility and your body's ability to absorb and then to release the levodopa in a steady way. So that might be one pathway that stress can impact Parkinson's. And then lastly, there's a minority of people for whom a big stressor, like a surgery or some other kind of big stressor on your body, can actually precipitate Parkinson's disease. There's a very, well, we used to think of it as very rare. I think it's probably less rare than we realized. A genetic variant that can really make people very prone to developing what's called rapid onset Parkinsonism after stressful events.
So there's lots of questions in here, and again, staying in the vein of our basics. Dr. Mantri, we have questions on vision changes in Parkinson's, depth perception, pain in Parkinson's, sleep in Parkinson's, and I would just love to encourage our community here to look at the website. My team is also going to be sending us information that's really specific on these subtopics of Parkinson's. So we're going to continue with the more generalized basic introduction questions, and I want you all to feel heard and walk away with some resources to deeper dive into some of these subjects with Parkinson's. Um, Dr. Mantri, could you explain or tell us if how we are able to identify if a certain symptom is a side effect of Parkinson's medication or is it a part of Parkinson's disease?
Yeah, great question. And it can be really hard sometimes to distinguish between the two. One strategy that can be helpful is if you keep a log or a diary of when you take your medicine versus when different symptoms happen. That can be a good clue as to, is the medicine triggering the issue, in which case it probably is a side effect, or is it more like when the medicine is wearing off? That issue comes up, in which case it's probably more likely to be an underlying Parkinson's thing. But it can be really hard to kind of tease that out sometimes. Occasionally, for some people where it gets really challenging to tease out, we sometimes even recommend what's called a medication holiday, where you stop taking all your Parkinson's medicines for a few days or a weekend or even up to a week at a time, and see what happens. Because again, if it's a side effect, that should improve when you stop taking the medicine. But if it's a Parkinson's symptoms, that will get worse when taking the medicine. I don't often recommend medication holidays to people because when you stop taking your Parkinson's medicines, all of your Parkinson's symptoms will come back. And so it's, it can be challenging to get through the day without any medicine at all. But if there's really a concern around, is this related to the medication or is it related to Parkinson's itself? Technically, a drug holiday or a medication holiday would answer that question. It's just can be really challenging to get through that day or that weekend without meds on board.
What I'm hearing, Dr. Mantri, is through this diagnosis of Parkinson's, there's sort of like a get to know my Parkinson's experiment of what works well for me when you're learning how much meds, less meds, and there's sort of this titration, for lack of a better word, where we're just learning what works best for me and what could be taken away or what can be added. Could you speak to a little bit about the process of finding our unique rhythm in treatment options?
Yeah, it is really a process. I like that term that you use because it's such a individualized thing from person to person. That's one of the ways that I think sometimes keeping a diary or keeping a log can be really helpful for people because it can help them kind of track how different things are affecting them and how much, and find that rhythm. It can be really hard sometimes to sit down and think like, okay, like what exactly is going on with my Parkinson's. But if you have a day by day or week by week kind of summary of Parkinson's issues, that can allow you to start looking for patterns or looking for triggers of different things, and get a better handle on how your medications are affecting you, how your other symptoms are affecting you, and like what your quality of life is right now and what you want your quality of life to be again in the next month, 6 months, year, and so on.
And speaking about this experiment with medication, I'm curious if you would be able to talk about the relationship with when to take your medication and its connection with protein and
Yeah.
how sort of that might impact the impact of receiving your levodopa if you are taking oral medication.
Yeah, for sure. Because anytime you take an oral medicine, it's gonna you take it, it's gonna sit in your stomach for a little bit, and then in the case of levodopa, it actually gets absorbed in the small intestine. So your medicine has to sort of move through the first part of your gut to be able to get really absorbed. So there's two big things to keep in mind there. One is that a heavy meal of any type will slow down gut motility. Things will stick around in your stomach for a little bit longer so that your stomach acid can digest that meal before it moves forward. So people sometimes find that if they take their levodopa together with a big meal, it feels like it doesn't kick in as well, or it takes longer to kick in because things are just not moving forward as quickly. The other thing around protein specifically is that protein amino acids can interfere with the levodopa getting absorbed in the gut itself. So it's not even so much the speed of movement through the gut, but it's the actual absorption of the levodopa into the bloodstream from the gut. So that can be affected by protein. It can also be affected by calcium. It can be affected by iron. So obviously calcium and iron and protein are important parts of a healthy, balanced diet. But I usually tell people, don't take your levodopa with a big meal, and definitely take it at least an hour before or after you're having a lot of protein, or if you're taking an iron supplement or a calcium supplement, just make sure you're taking them at different times compared to your levodopa.
Thanks, Dr. Mantry. Nellie, I hope that answered your question and thanks for asking it. A question from Paul about when to start treatment. How do you know when it's time to start taking medication if you are in the early onset or early stages of Parkinson's disease?
Yeah, I would say that, starting treatment in terms of exercise and diet should probably be, day one, or even ideally before you get Parkinson's. You want to be doing this stuff proactively if you can. But the decision on when to start medication, prescription medication, really depends on how much your symptoms are bothering you. And what I often ask my patients is, do your symptoms keep you from doing things that you want to do or that you need to do? Whether that's, you're working and you need to be able to type 100 emails a day, or you're retired and you want to be able to travel or golf or do, whatever it is that you want to do through a day. You want to be able to take care of your kids or grandkids. If your symptoms are interfering with your ability to do that kind of thing, and impacting your quality of life, that's absolutely the right time to start medications, because our medications are so effective at treating those symptoms. I never want people to like miss out on, good benefit from medicine. But there's always side effects to be considered and to talk about and to think about. But yeah, my rule of thumb is often, are your symptoms keeping you from doing things that you want to do, or making it harder for you to do things that you want to or need to do?
Appreciate the way you answered that, Dr. Mantri. And I would love to ask, there are a couple of questions about cognitive changes, and most specifically hallucinations, and staying in the vein of Parkinson's basics, right? The subject of hallucinations can be a sensitive one when we're speaking about the progression of Parkinson's disease. So could you just speak to hallucinations and its relationship to Parkinson's and its relationship to Parkinson's medications?
Yeah, for sure. So hallucinations are sensitive to talk about for many people, but they're also very common for many, many people with Parkinson's. Usually, again, not in the earliest stages of the disease. It's usually something after somebody's been living with Parkinson's for a number of years. They may notice something out of the side of their, out of the corner of their eye, or kind of the sense of passage. We sometimes call it sense of presence. Um, and at times that can be related to Parkinson's medications, especially dopamine related medicines can make you more prone to having those kind of sensations. But they're also related to the underlying disease itself. The protein that causes Parkinson's, just like it gets deposited in the motor parts of the brain, can get deposited in the occipital lobe back here that controls our vision and can make your mind play tricks on you, if you will. And so just like with other symptoms, it's important to try to distinguish, is it related to the timing of your medicine, or is it not related to the timing of your medicine? Do adjustments in your medicines help? And again, if the hallucinations become scary or bothersome or irritating, there's lots and lots of different ways to manage it, either by, number one, adjusting whatever medicines you're currently taking, or there are add-on medicines that you can use to help suppress hallucinations. So there's lots and lots of ways to manage them if they become bothersome.
I appreciate you normalizing the experience of hallucinations in Parkinson's, and also identifying the relationship between meds and Parkinson's disease itself, and also recognizing that we get to choose, we get to be our own advocates to say, this really isn't bothering me, or it really is impacting my life, and there needs to be a resolution. So thank you for empowering us with that knowledge, Dr. Mantri.
Yeah, that's always the way, especially with Parkinson's. How much is it bothering you, and what can we do to help it?
And just checking our time here, we have just one more minute with our community here of speaking to the basics of Parkinson's disease. Any final remarks or a closing message that you'd like to share with our community?
I just want to thank you all for being part of this webinar and listening to this. As Krista was saying, one of the main things that I hope that folks get out of these talks is a sense of empowerment and a sense of being a self-advocate in some ways, being able to know what Parkinson's can look like for you, for others, and then being able to take that information forward to your care team so that we can help you as best as we can.
Thank you, Dr. Mantri, so much for sharing your time and your knowledge. The Parkinson's Foundation is truly just privileged and honored to have you as our Chief Medical Officer. So thank you so much for sharing. And I want to thank each of you for showing up today in a place of curiosity to learn for yourself or for your family member or friend who's impacted by Parkinson's if you're supporting someone with the disease. Um, Before you'd go, I'd like to share some resources with you. Just a reminder that we do have other PD Health at Home virtual programs. Each week, we offer sessions tailored to people with Parkinson's and their care partners, including Mindfulness Mondays, Wellness Wednesdays, Fitness Fridays, expert briefings, and our Spanish language series, Y Salud en Casa. Be sure to visit our website to see what's coming up and explore our archive videos on YouTube. You can learn more by visiting parkinson.org/PD Health. And I know, my friends, there were lots of questions that we weren't able to get to today due to the nature of the intention for our program. The Parkinson's Foundation covers deep subjects that go beyond the basics of Parkinson's disease. So I'd love to encourage you to call our helpline, allow them to support you in navigating to get to the resources that you need. Whether you had a question about genetics, pain and Parkinson's, finding a movement disorder, speaking about symptoms, you name it, call our helpline or visit our website at parkinson.org. They are a great resource to support you on your journey. Before we wrap up, I just have one favor to ask of you. Your feedback is essential to shaping the Foundation's programming. As the webinar concludes, a survey will pop up on your screen. Please just take a moment to share your thoughts and let us know what topics you'd like to see in future sessions. I read through these surveys myself with my team, and we do deliver on programs that you provide us insight on. So please take some time so that we can deliver to your needs. Again, thank you so much for joining us today. Together, we can navigate this path and continue building a brighter future. Thank you again for being with us, and we look forward to connecting with you at future programs. If you have any questions or need additional support, don't hesitate to reach out to that helpline. Take care and be well.